This is Tanya, Noor's mom. So today I'm going to be speaking to you all about spit ups in babies. So when we become new parents and the first thing we give our babies is milk, and then we see our babies spitting up milk, and then we start asking ourselves questions like, are we doing something wrong? Is my baby vomiting? I think this is because of formula. Or am I not eating something right that's affecting my breast milk? So, I am here to solve all of your problems and queries. So, the number one thing is that spit up in babies is developmentally normal. It is very, very common in healthy babies. In fact, 50% of all babies from 0 to 3 months of age do experience spit ups, and 70% of all those 50% spit up thrice a day, and some also spit up 10 or 12 times a day. Spitting up does not interfere with your child's growth, irrespective of whether you're breastfeeding your baby, formula feeding your baby, or on a combination feed. Spit ups are common, normal, and healthy. So, how do these spit ups happen? So, these spit ups are a result of a natural body reflex because of the immature digestive system of babies. So, digestive system consists of a food pipe called esophagus, which is connected to the stomach. Now, this connection is made by a muscle called the esophageal sphincter muscle. Now, the job of this muscle is to keep all the food inside. But because the baby's digestive system is not mature, the muscle is not developed, it is not as strong. So, the moment the stomach is full and it starts exerting any kind of pressure on the muscle, this muscle opens up and all that milk comes out. And this is what causes spit ups. This is the main factor that actually causes babies to spit up milk. Now, like I said, babies usually start spitting before 6 months of age, maximum between the 0 to 3 months mark, and it peaks at 4 months. But as the baby starts growing older, his digestive system starts getting mature, he starts sitting up more rather than lying down all the time. All these spit ups start reducing, and by 1 year of age, all of them suddenly disappear one day. So, the good news is you don't need to worry about it, they will go themselves when the baby turns 1, when the baby is old enough, his digestive system is old enough. Now, when can these spit ups occur? So, now these spit ups can occur anytime during a feed, just after a feed, or 15-20 minutes after a feed along with a burp, or it can also occur 1 hour after a feed. So, it can occur anytime. Now, what is the kind of milk that comes out in baby spit up? So, a whitish, creamish colored, milky substance comes out in the form of baby spit up. Now, this can look like in the form of curdled milk, or paneer, or cheese, or it can even look like plain milk. So, how it looks depends on for how long has the milk stayed inside the stomach or the digestive system. So, if your baby usually spits up, say 15-20 minutes after a feed along with a burp, or 1 hour after a feed, so that means that milk has traveled through the food pipe, gone into the stomach, has got mixed with the stomach acid, and then because of some reason, because this muscle could not keep the milk inside, it came out in the form of curdled paneer. Because just like we add nimbu to milk, it becomes paneer. Similarly, when that milk got mixed with the stomach acid, it became paneer and it came out. However, if your baby spits up during a feed, then there's a high chance that the milk, the spit up, will look like plain milk only, because the milk never even got a chance to go to the stomach to get curdled. So, in either cases, it is absolutely normal. One thing that you must note is that if your baby is greater than 6 months old and he has already started solids, then the color of the spit up might be of the same color of the food that the baby has eaten. So, even that is normal and there's nothing to worry about it. The quantity that you can expect in baby spit ups is around 1 tablespoon to 2 tablespoons also. But we also must remember that all babies are different, and some babies might not spit at all, while some babies might spit all the time, more than 10 times a day. It all depends on their own unique digestive abilities. But a point to note is that formula fed or combination fed babies tend to spit up more than breastfed babies because formula milk is heavier than breast milk. However, there is nothing wrong in formula milk and it's absolutely okay. Now, what are those factors that causes that sphincter muscle to open up and those milk contents to come out of the mouth? What are the causes of baby spit ups? So like I mentioned before, the basic cause is immature digestive system. Babies' digestive abilities are not developed enough. But the second cause is overfeeding. So if you feed too much milk to your baby, so we know the baby's stomach is very, very small. So if it is already got full and we're giving him more milk, then obviously that muscle, since it's already weak, it cannot keep the milk inside. There will be extra pressure on the muscle from that extra milk, which will cause the sphincter muscle to open and that curdled milk or baby spit up to come out. So this is one cause. Another cause is overstimulation. So if, right after a feed, we start rocking our babies, swinging our babies, we put them on their tummies or we make them sleep on their tummies. All of that, it kind of shakes the contents in the baby's stomach, or it puts pressure on the baby's stomach. And when that pressure is there in the baby's stomach, it opens up the muscle and that milk comes out in the form of curdled milk. Another reason is swallowing too much air while feeding. So if your baby swallows too much air while feeding, those air bubbles get trapped in the stomach. Now, that trapped air causes discomfort to the baby. So when the digestive system tries to release that air, it puts pressure on the muscle opens, and along with the air, the milk also comes out. And that is what happens when a baby burps, and while burping, that milk comes out. It is usually this case. And how babies swallow air during feeding? If the baby's latch is not proper on the breast nipple, or if the baby is bottle feeding and the bottle nipple size is too large, or the angle of the bottle is not right, and there's a lot of air in the bottle nipple. So all those things can cause the baby to swallow too much air. Another reason where babies swallow a lot of air while feeding is their feeding position. So if the feeding position is not right, baby feeds more in a lying down position rather than an upright position. Again, it puts pressure on the muscle and the contents come out. Last cause is a milk allergy or a milk intolerance. This is not a very, very common cause, but it can be one of the causes. If the baby is allergic or intolerant to any kind of milk substance, then there's also a chance that the baby feels discomfort, the stomach is not very adaptive to the milk contents, and then the sphincter muscles open and the spit up comes out. So these were all the causes that can cause baby spit ups. But what you need to remember is, if your baby is a happy spitter, when I say happy spitter, it means your baby, whenever he is spitting up milk, he is doing it without any effort. There is no crying. The spit up comes very smoothly. There is no force that he has to make. And after the spit up, he is very, very happy. He is active. Then there is nothing to worry about. This is normal. This is what is expected from babies, and it will automatically go by 1 year of age. But when is this not normal? When are spit ups not considered normal? So the number one reason when you should be concerned is when your baby starts vomiting. Now vomiting is different to spit ups. Like I just said, in spit ups, that milk comes out very, very smoothly. The baby doesn't even come to know. Baby becomes happy after it and there's no crying. However, in vomiting, the milk comes out with a force. The baby is usually discomforted. He's very uncomfortable. It takes him a lot of pressure to get those contents out, and he starts crying after that. That is vomiting. So if you see your baby is vomiting after every feed, or he's vomiting every day very, very frequently, then it is a cause of concern. Second, if you see your baby's weight gain is not correct, he's not gaining weight as per his age, then that can be a cause of concern. If you think the baby is choking up on all the spit up, that he's not able to take it out and he's kind of choking, can't breathe, then that is a cause of concern. Next, if you feel your baby is refusing to feed repeatedly, he hates that sight of milk also. If your baby's spit up is either deep yellow or green in color, or it has red stains in it, then that can be a cause of concern. Or if your baby is just very uncomfortable, unhappy, is crying all the time, then that can be a cause of concern, and you need to go and get this checked with your doctor, because there might be some underlying condition like pyloric stenosis or GERD, which is gastroesophageal reflux disease, that might be troubling your baby, and for that you need medical help. But otherwise, if your baby is a happy spitter, then there's nothing to worry about. Now, how do we reduce these spit-ups? First, feeding position. So ensure that you're feeding your baby in an upright position, in an angle of 30 degree. So whenever you're feeding, ensure the baby's head is above his stomach. Don't feed him in a lying position. Don't put him on the bed and feed him with a bottle. If you're feeding on the bed, make sure his head is on a pillow. And even after feeding, when the feeding is over, please hold your baby in a straight position, upright position on your shoulder, so that there are no chances of any kind of air accumulation, and it drastically reduces the spit ups. Second, burp your baby. I cannot stress on this point enough, and I have already said this many a time. Burping is very important. You should burp your baby both during and after feeds. If you're breastfeeding, then you should burp your baby when you're changing from left to right side. Or if you're formula feeding, then you should burp your baby every 2 to 3 ounces. Third, do not overfeed your baby. Try not to overfeed. And how do you do that? You do that by feeding your baby in small amounts in frequent intervals. So according to the American Academy of Pediatrics, they recommend that you should breastfeed your baby every 2 hours, and formula feed your baby every 2.5 hours. And the amount that you're offering should not be very large. It shouldn't be like 4 or 5 ounces in one go. Stick to 2.5 ounces, so that your baby's stomach doesn't get full, because when it will get too full, it will push on the muscle will open and all the milk will come out. So smaller and more frequent. Next, try to ensure that your baby is not swallowing a lot of air while feeding. Now, how do you do that? You've got to, number one, if you're breastfeeding, ensure that your baby's latch is proper. If the latch is not proper, you can use a nipple shield. Second, if you feel that you have a very strong and fast breast milk letdown, then try to feed your baby in a lying position so that he feeds against gravity. If you're bottle feeding your baby, ensure that the bottle nipple size is not too big and not too small for the child. It should be accurate. I have a separate video on how to choose the right size of nipple for your child. Also ensure the angle of the bottle is correct. The angle of the bottle should be such that when you're feeding milk to your baby, the nipple should have milk. There should not be any open pockets of air. It should be full milk. So the bottle should be in a straight position, horizontal position, and not a slanting position. If you're formula feeding your baby, it's a good idea to try to change the brand of the formula, because sometimes, like I said, every baby is different and they react differently. And sometimes a particular brand is heavier for the baby to digest. So we started with Aptamil. So Aptamil went on very nicely, but when Noor's spit up started increasing, we shifted to Enfamil. Then, if you are formula feeding your baby, you can use my family recipe to make formula water. And trust me, your baby's spit ups will come from here to here. This is a tried and tested technique you can use from 0 months onwards. I myself used it on Noor, and so many moms across Instagram have used them and they're very happy with it. It really works like magic. Please avoid any overstimulation. So the moment your baby has a feed, do not rock him, bounce him, sway him. Do not put him on his tummy. Do not give him tummy time immediately. Or don't even make him sleep on his tummy, because all of that will put pressure on his stomach. Also, ensure that you're not making your baby wear any tight clothes or tight diapers that are putting pressure on the stomach, because once again, any kind of pressure can cause the muscle to open up. And lastly, in case your baby does have a milk allergy or lactose intolerance, and if you are breastfeeding, then you should try to avoid any dairy items in your diet. And if you're formula feeding, then you can consult with your doctor and move to a lactose-free formula. So that's about it. Keep writing. Take care. Thank you. Bye-bye.